my screen. Hi, everybody. Nice to meet everyone virtually. Let me make sure I get the right slides here. And I think I'm going to have to slip back 1 second. Get to the right slide and play from start. Can everyone see this?
Yes.
Excellent. Okay. Well, again, thanks for the intro. I'm gonna run through this just very quickly, but really look forward to questions if people have them later. So the UK EMT is a UK government capability, which means that we at the Foreign Commonwealth and Development Office, our name has gotten longer recently, but the FCDO, the government determines where and when the EMT goes out. We're driven by some key partners that I've listed at the bottom. UK-Med is a health NGO, so it's UK-Med is not the UK EMT, but they do the recruitment and training of our membership and help on the deployments when we send out the team. And I'll also highlight Humanity Inclusion. It used to be called Handicapped International. They are a fantastic organization we'll get to later that does a lot of rehabilitation and physiotherapy work that we do, which in the past year has been invaluable and sort of driving and helping support the WHO guidelines on recovery from COVID-19. We have the UK Fire and Rescue Service that is sort of the operational arm that helps construct things in the field, and a contractor, the Palladium Group, that makes sure that everything gets from point A to point B. So let's see if I can just go forward here. So what is the UK EMT? As Dan mentioned, while the PHRST is focused on its triple mandate, the EMT focuses alternatively on health service delivery and clinical support to health systems around their ability to treat and care for patients. So less about the investigation and the research, and some of the capacity development we do too, but in a different way. We are sort of the patient-facing component. So our staffing historically has come from the UK, but 2020, the past year, has been a total sea change for us. And as you know, the vast majority of the clinicians in the UK were obviously focusing on the COVID-19 outbreak domestically. So we began to look abroad, and we've been recruiting internationally for spots on the UK EMT. We'll say it's a very coveted and competitive process to get onto the EMT, but it has been a really great change for us, because now we have a much more multinational, multilingual, and multicultural component to our EMT, which I think is just fantastic. So, so a little more on that. Also, I should mention at the bottom here, of course, we love working with the PHRST and PHE. So while we can deploy anyone cross government, we really benefit from our relationships with PHE, and we can deploy members of these teams when we have a response. So let's see if I move on here. Great. So these are some of our specialized care teams. I won't go into too much detail, but in the background, you can see some of the physiotherapists working with a kid in Samoa during the measles outbreak, a situation where PHE joined our, one of the PHE FETP fellows joined our team. But again, rehab, an incredible piece of work that we do, which is beyond just the setting up of a field hospital and treating patients. So let me move on here. Also a lot of sort of emergency management, rapid health assessment, and work that is beyond the actual setting up of a clinic and sort of supporting a health system. This year we've had to do a lot of remote technical assistance where we are helping from home and linking up health systems remotely. So we can provide just-in-time trainings, we can help design programs and help, like, for example, we've seconded people into the WHO to help write guidelines for setting up of COVID treatment centers and the rehabilitation guidelines, which have been really helpful. I'll add here that I'm embarrassed because Dan's and Ashley's maps are much cooler than ours, but we're gonna work on that. But this is some of the places that we've been, similar to, and also you can see the green square in the lower left-hand corner is Samoa, where we were just over a year ago. Similar, we also primarily focus on responses to low and middle income countries because they, of course, lack the resources to respond effectively, but we are indeed a request machine, which means we're able to deploy anywhere in the world on request from could be a request that's received through the WHO. It could be a request that comes bilaterally. We'll talk to that in a minute. But as we know, earthquakes and other sudden onset disasters don't discriminate. We were on the ground in Beirut shortly after the explosion last year, which became less of a mass casualty incident and more of a COVID emergency because of the taxes on the health system to respond. But even that, we called on our PHE colleagues for advice and engagement. So really, we're appreciative of the partnership. Here we go. So you know, we've heard some discussions about how the PHRST receives requests for assistance. We have a slightly different mechanism than that WHO GORN mechanism that Renee described earlier. We work through the WHO global EMT mechanisms, also part of WHO emergencies. Same thing, these requests will come on behalf of a government, sometimes from the WHO directly if it's a sudden onset disaster. And these requests are put out globally for all EMTs across the world that would be registered with the WHO or classified with the WHO. And we're, you know, one of the EMTs that respond to those requests. We were quite busy last year, of course, with requests for assistance in the context of COVID. I believe that was the most, I mean, certainly was the most deployments in the history of the UK-EMT. And I believe we were one of the we were an EMT that responded the most internationally of any, of almost any other country that deployed EMTs. So again, we can get requests from the WHO. We can have requests that come through our FCDO regional offices or country programs, or we can get requests cross government. So if, for example, the PHRST required someone to join their deployment, we could deploy people into their platform or work us alongside it. So again, getting back to what we were talking before, we at the FCDO love the PHRST and what they do as part of their triple mandate. We are engaged through sitting on the PHRST project board, and we coordinate on these requests for assistance. We're proud to respond with them when the opportunity arises, and equally grateful for their support if and when PHE members join the UK-EMT. Just a little earlier, you were looking at some members of the field epidemiology training program, and I saw in one of those Paula Bloomquist, and if you look in the very middle here, that's Paula out with us in Samoa. And it's an example that you can also see on the right, someone from the Australian medical assistance team. So in addition to the UK-EMT, so it really just shows how we really want to and do work together abroad, and it's a great multiplier. It's really useful. If people want to join the EMT, we do have a community of practice that people can apply to register with. Again, that is not something that assures anyone a place on the UK-EMT, but it is a way to become engaged and learn more about us. And listen, if there are licensed clinicians and you happen to live on this planet and you'd like to work with the EMT, please, go through and search that out and sign up with us. Really happy to take any questions that people may have when we get to that. And thanks so much.